Welcome back to my channel. So today I've come up with a topic for you on bad breath. So this can be very embarrassing situation when your breath becomes bad, and that can be even leading to a lot of complications in people. So let me give you more details about what exactly is bad breath, what is the reason for this, and how you can try to avoid this. So as I told you, bad breath, the other name for it is called as halitosis. So 1 in 4, okay, globally if you consider, 1 in 4 will be having this problem. So it can be very embarrassing situation, and even it can cause anxiety in people because of the problem that they are facing. So basically there are a lot of solutions available, like there are a lot of mints, mouthwashes, a lot of things available, but they can be temporary sometimes. So identifying the reason for this, okay, so what might be the cause for this bad breath is very, very essential. So certain times when you have certain food like garlic, onion, you can have this issue, but there may be some major conditions because of which this is happening. So identifying this by your dentist or physicians can be very, very helpful, so that you can understand the root cause of it and try to rectify it at that particular stage. So basically what's happening here is that the bacteria are the main cause for it, okay. So these bacteria are producing a lot of sulfur containing compounds, and these sulfur containing compounds are having this odor basically, okay. So because of which you can have this problem of bad breath. So once this bacteria starts breaking down the food material, whether it is protein or something like that, so they produce a lot of odor containing compounds like volatile sulfur compounds. So dentists can help you identify the situation, and if they are not capable of doing it because of some more problems associated other than dental issues, they will be recommending you to a physician who can check your situation further. So as I told you, the oral hygiene plays a major role here. So if you see that the bad breath condition is not becoming better, you have this issue continuously, then it's better you consult the dentist there and see what is the main reason for it. So you need to brush your teeth and tongue after eating. So this will help to a greater extent, so that the bacteria are lost from your tongue region. And drinking plenty of water can be also of some help, so that you are trying to dilute the situation there. So as I told you, if the dentists are not basically the condition is not because of dental issues, then it is because of some other underlying issues, then the dentist would recommend you to consult a physician. So the main causes for this could be accumulation of bacteria, as I told you. So accumulation of bacteria in your dental region and again in the tongue region can be the main reason. And as they are consuming the food and other things in your system, they start producing this compounds, and that is leading to bad breath. So other reasons could be dental caries, food that you are eating, smoking. So these are some of the reasons or causes which can lead to bad breath. Other causes could be these. Okay, sinus, digestive disorders, lung diseases, constipation, tonsils. So those kind of issues if you have, even that can lead to bad breath. So deposition, okay, as I told you, bacteria can deposit on your dental and tongue surface. So this is how it deposits. So there are variations, or there are depressions in the surface, and in the depressions these organisms can survive. And as they are surviving, as they are eating the food and other things there, they are producing this gases, and that can lead to this smell, okay. So this deposition we need to remove, and that is why cleaning of the tongue regularly is very, very essential. So apart from that, people imagine people are wearing dentures. So these dentures, when you are wearing, if you're not cleaning it regularly, the food particles can deposit in those materials. And once the food is deposited, organisms can start growing, they can start multiplying, and indirectly they can start producing this odorous compounds which can lead to bad breath. So plagues are one more reason for this. So maintaining your dental hygiene, trying to remove the plagues, having a routine checkup of your teeth would be very essential here. And saliva, as I told you, that can have a cleansing effect, because they can neutralize the acids produced by these organisms, and that can lead to some benefits. And definitely if you are having some infections of gums, and once gums are infected, there will be a gap between the gums and the teeth, and in this gap food can deposit, organism starts growing, and acids start producing, which can lead to bad breath. So these are a lot of reasons and causes for basically the bad breath. So one more reason could be ketoacidosis. So this is a rare cause, but this also can be a reason for bad breath. So this is basically related to your insulin production. So we know that pancreas are there in our body, which pancreas produces insulin, and that is very, very essential to regulate the glucose level in our body. So basically they act as a mediator for the transport of glucose from the blood to the cells, because cells require glucose for their energy. So if insulin is in normal levels or a healthy body, so in a healthy body, insulin is produced in normal levels, and once it is produced in the normal levels, it is taken up, the glucose is taken up from the bloodstream into the cells. So this is the normal mechanism. But in a diabetic patients, what happens is the body is not capable of producing insulin, right? So pancreas cannot produce enough insulin, so it produces less insulin. As it produces less insulin, it can take only some of this glucose, right? And in the body, what happens is the extra glucose which is there and the fat which is there in the body as deposited, this breaks down and it forms some harmful keto acids. And there are a lot of reports which tells that these keto acids which are formed, they are odorous. Okay, since they are odorous in nature, it can indirectly lead to bad breath. So this can be one more reason for bad breath, which is because of the diabetic condition. So there are a lot of reasons. So identifying the right cause in you would be very essential. So that based on that you need to work on, like how to get rid of that situation. So other symptoms, as I told you, could be kidney diseases or kidney failure, liver diseases, diabetes, sleep apnea, and even certain cases of gastral problems also can lead to this bad breath situation. So these are some more symptoms which can lead to this particular condition. So coming to diagnostic options, so how do you diagnose if you are having this issue? So doctors will definitely do a physical examination. So basically they will check the mouth and the nose to check the smell. They may even do a tongue scraping to see the growth of organism. So that might be cultured and they identify whether it is a organism causing odor. So in that way they can try to identify it. And there are certain equipments like helimeter. So this is an example, or this is a figure to show you a helimeter. So you have to breathe in that, and based on that the volatile sulfur compounds, if produced by the organism, would be displayed here, and the concentration of that would be displayed. So higher the concentration, more is the effect. So that is what you get to know, that more of these organisms are growing. So if they are growing, that means it can lead to bad breath. So indirectly, by the measurement of volatile sulfur compounds, you get to know that the organisms are growing, which can produce bad breath. So apart from that, there are high-end equipments also, that is GC, gas chromatography. So this is the instrument which can be very useful to identify the volatile sulfur compounds. So the saliva basically can be used as a sample here, and if the person is suffering from bad breath, so there would be organism producing this volatile sulfur compounds. So in the saliva it would be present. So the saliva samples can be injected into the gas chromatography, and then they try to identify if these sulfur compounds are present. So basically hydrogen sulfide, methyl mercaptan and dimethyl sulfide. So these are the sulfurous compounds. So if these compounds are present, they would have a specific retention time and you would get a peak in the chromatogram. So if you identify that these peaks corresponding to these molecules are present in the sample, we can identify and we can diagnose that this person is suffering from bad breath because of this particular condition. So in this way, diagnostic options are available which can be of use. Apart from that, there are certain tests called as BANA test. So this is definitely to check the enzymatic levels. So we know once organisms are there, they produce a lot of enzymes for breaking down the molecules. So as they are producing these enzymes, the enzyme level itself can be checked using this particular test. So higher the enzyme level, more would be the production of the requirement, or the more would be the quantity of organisms present in the particular sample. So in that way, using enzymatic tests also you can try to diagnose. And even one more is beta galactosidase test. So this is one more enzyme which is present in the saliva in case these organisms are there in your saliva. Okay, so if these organisms producing these sulfur compounds are present in the saliva, they produce a lot of beta galactosidase. So this is direct correlation. Higher the concentration of beta galactosidase, more is the odorous molecules produced by this particular organism. So in this way, by either enzymatic test, gas chromatography, helimeter, or the physical examination, the dentists or the physicians later could diagnose if you are suffering from this particular condition. So coming to the treatment options, as I told you, mouth rinses, toothpaste, antibacterial agents, so these are available. So this is basically to prevent the buildup of bacteria, right? So to avoid the plaque formation, we can try to use this, but this should be recommended by the doctor, and then only you can try to utilize it. So apart from that, treatment of gum diseases. So as I told you, if you are suffering from gum diseases, there would be a gap between the gum and the teeth, and the gap would be the reason. So periodic dental checkups would be very, very essential so that you can avoid the situations. So in this way, these are some of the options which are available, but definitely doctors can give you better suggestions. So, okay, so this video is just to create awareness about the situation. The actual treatment options you can try with your doctors. So coming to the takeaway messages, as much as possible, we can, in case you are having these issues of bad breath, try to avoid food like garlic, onion, so that you don't aggravate the situation again. Keep your dental hygiene very well. See to it that you brush your teeth. Along with that, you brush your tongue also, so that the organisms don't deposit on the tongue and it leads to complications again, because we have seen that the organisms present on the surface of the tongue also can lead to bad breath. So that is very, very essential, maintaining your oral hygiene, and try to avoid dry mouth. See to it that you drink plenty of water, because water can be a natural cleanser, so it can have the cleansing effect. So indirectly, by drinking a lot of water, you can avoid these bad breath situations. And apart from that, smoking and chewing tobacco, you should try to avoid this, and please visit your dentist regularly. So in this way, I think you can try to be responsible and see that you can reduce the effects of bad breath by maintaining good oral hygiene. Thank you for watching. Thank you for supporting me till date. If you have liked this video, please do like my videos. Please subscribe to my channel Geeks and Geeks, and please share this video with maximum people so that I can make much more educational videos for you like this. Thank you for your support till date. Have a nice day.